Welcome to This Week in Health IT News, where we look at as many stories as we can in 20 minutes or less that's going to impact healthcare and health IT. It's Tuesday News Day, and here's what we have on tap. Intermountain is tapping 500,000 patients for genetic database. 1 in 6 ER visits or hospital stays triggers a surprise bill, and Congress is going to take a look at that. Also in the government, FCC is looking to approve $100 million in new funding for telehealth to expand the use of telehealth. And we have a bunch of cloud computing stories, and I'm looking forward to talking about that. My name is Bill Russell, recovering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health IT leaders. This podcast is brought to you by Health Lyrics. Every health system needs to do more with less. Let's talk. Visit healthlyrics.com to schedule your free consultation. Want to support the fastest growing podcasts in the health IT space? Here are 5 easy ways you can do that. Number 1, share it with a peer. Follow our social accounts, LinkedIn, Twitter, YouTube. Interact with and repost our social media content. You could also send me feedback, questions, guest recommendations, or news stories you want me to take a look at. Bill at thisweekinhealthit.com, or subscribe to our newsletter on the website. So let's get to the news. Intermountain Healthcare seeking 500,000 patients for genetic database, unmatched in scale and scope. Erin Alberti from, what's the source? Salt Lake City Tribune. So she starts with a story. Floyd Hatch's little brother was just 23 years old and seemingly healthy when his heart abruptly stopped and he dropped dead while playing football with a friend. 10 years later, Hatch said his sister, 47, collapsed and died. Hatch had run 41 marathons when at age 64, his heart began to fail him. The culprit was plainly not lifestyle. Hatch had a dangerous genetic mutation that affects a protein in the walls of his heart. Further testing showed his 28-year-old daughter, Courtney, had it as well. So this just drives home the need for genetic testing, genetic databases to be more proactive with healthcare. Here's a quote from, actually, it's a pretty short quote. This is the Mark Harrison, CEO of Intermountain. This has the potential to change the way we think of disease. The article goes on to say they're seeking 500,000 patients who are going to provide 2 vials of blood each for genome mapping to study links between people's genes and their heart on scales doctors say hasn't been done before. Let's see. We will take the whole genome sequence and combine it with clinical outcomes to generate a largest of its kind database that has ever been configured, said physician Lincoln Nadald, Intermountain's chief of precision health. There are other large genetic databases. He cites some of those. What makes this one different is the health system also is the participant's healthcare provider. That enables the researchers to track patients' medical histories and outcomes in conjunction with genetic information they provide to identify genetic determinants of health. Thank you, Nadal said. So, so what's the so what of this story? First of all, kudos to Intermountain. I love this. Exciting to knit together research and the practice of medicine more closely and to get proactive in the way that we do this. It's just great work from Intermountain. This is healthcare is changing rapidly right before our eyes, from reactive to proactive. This is one of those steps from experiential to data-driven. We used to rely on the gray hair of the physician, and much more of it is being data-driven and will continue to be so. It will also continue to transition from episodic to more of health as a service. For those of us who want it, we're going to be able to have a lot of sensors and be connected directly to clinicians who are also giving us proactive information on based on our genome, based on our sensor data, based on other things. So I think we're going to just continue to see this. From a health IT perspective, this is knitting together an awful lot of different technologies, huge data sets, by the way, huge data sets, huge data requirements, bandwidth requirements are going to be significant. So this, from a technology perspective, is no small task. The good news is I don't think it represents a lot of new technologies, just a way of knitting together a lot of technologies that are already in place. So let's move next story. So our next story is 1 in 6 ER visits or hospital stays triggers a surprise bill. And this is Ricardo Alonso Zaldivar. Wow, what a great name. AP News. And, the fact that this is AP News, the fact that it's getting that kind of coverage, I think is going to be the story that I'm going to focus on. So the report from a nonpartisan Kaiser Family Foundation finds that millions of people with what's considered solid coverage from large employers are nonetheless exposed to out-of-network charges that can amount to thousands of dollars. So this has caught the attention of Congress. And next Wednesday, the Senate Health, Education, Labor, and Pensions Committee is set to vote on a bipartisan legislation that would limit what patients can be charged in their in-network deductibles and copays, tied it to their in-network deductibles and copays. The bills from Senators Lamar Alexander, Republican from Tennessee, and Patty Murray, Democrat from Washington, would require insurers to pay out-of-network doctors and hospitals the median or midpoint rate paid to in-network providers. The House Energy and Commerce Committee is working on similar legislation. President Trump has said he wants to sign the bill. So, this is one way to address the problem. The other way to address the problem is through setting up arbitration, which has been done in New York and some other locations. This is considered a less bureaucratic way of doing it, just tying it to the median or the midpoint. That way you won't have to build this massive infrastructure that does arbitration on these kinds of bills. But what I want to really focus in on this story is that, again, I just keep coming back to election cycle, election year. These stories are going to be front and center. Congressional leaders and people who are running for office are going to be going out of their way to try to address this issue, not in a bad way, not a bad thing, but as these stories get escalated, healthcare leaders, healthcare providers are going to be called to talk about what they're doing in this area, and my recommendation around this is to just get in front of it. Be able to answer the question of what is your strategy on price transparency? What's your strategy on helping people to navigate the financing of healthcare? And you're just going to want to get in front of it. I mean, the best case scenario is to have a plan or strategy. The next is to have actual progress being made towards that plan. And the best case scenario would be to have solutions in place with testimonials from your patients. So I just think you're going to want to get in front of this, at least have your story straight, at least have something that you are heading in this direction. Congress is going to do what they're going to do. You can't impact that, but it's good to have these programs in place for the communities that we serve. Okay, let's talk cloud. There's a lot to talk about in terms of cloud. I'm going to pull 3 stories out here. I'll go through them very rapidly. I'm not going to hit on all of them. The first is 2/3 of enterprises disappointed by cloud migration journey, says Accenture. The source is Which-50, and it's their staff writers. A couple of statistics here. Based on the survey of 200 senior IT professionals from large businesses worldwide, not necessarily just healthcare, the report is called Perspectives on Cloud Outcomes. Expectation versus reality suggests that cloud migration journey is more complex than anticipated for innovation and efficiency. While the vast majority of companies cited achieving some level of their desired outcomes, roughly 90% of those, only about 1/3 of the companies on average reported that they have fully achieved their expected outcomes across 4 categories: cost, speed, business enablement, and service levels. And in those, the rough percentage is roughly about 30 to 35% have achieved their goals in those areas. The barrier for realizing the benefits of cloud that survey respondents noted most frequently when asked to identify the top 3 were security and compliance risk, was cited by 65% of the respondents. Complexity of the business and organizational change, 55%. And legacy infrastructure and or application sprawl, 43%, and lack of cloud skills in within the organization, about 42%. One other thing of note: companies employing private clouds tend to lag their counterparts employing public cloud or hybrid cloud models when it comes to fully achieving expected outcomes. 28% to 42%, roughly. So so what on this? I think the reason people are struggling is because cloud is not a monolithic technology. It's not like, we're going to adopt Microsoft Office. Cloud is a set of technologies. So there's platforms, there's applications, there's infrastructure, there's native cloud, and each one of those has different characteristics and can be applied differently within healthcare, definitely, but within business just in general. If you're going to do applications as a service, if you're going to do Workday, that's one way of going about it. If you're going to do infrastructure, say an AWS or even an Azure, which Azure is more of a platform, but as is AWS. I mean, they have aspects of infrastructure and platform across the board. They are different. They're very different. The other thing I would say is lift and shift to the cloud will cost you more money, period. You have to change the way you're doing things from how you're doing them today to realize the benefits. There's no way of getting around it. You shouldn't need, you'll only need like 15% of the people you need today. If you don't have a data center, you don't have raised floor, you don't have to put servers into racks, you don't have to do, tapes and those kind of things for backups. It will just radically change the way you're doing things. If you don't change the way you're doing things, what organizations are finding is cloud costs more. Just flat out does. If you're going to do it the same way you're doing it today. I'd say the third thing is your biggest obstacle to adoption isn't the business. The business is going to say, hey, I use the cloud at home. I use the cloud for email. I use the cloud for storage. I share my photos. I use the cloud all the time. It's really kind of cool. You're not going to get a lot of pushback from the business. You're going to get it from the IT staff because it's a dramatic change for IT. You have to do your change management within the IT staff first and foremost before you move out into the organization. And I think what you're going to find within the organization is not much pushback. So a couple stories to sort of back this up. Hunterton Healthcare migrates to Google Cloud G Suite and saves $1.3 million. This is Bill Sawicki, Healthcare IT News. I'm not going to go through the story. So Hunterton's a smaller health system. They decided to do the migration department by department, not necessarily in a big bang approach. Again, highly recommend that. Things like Office did not go away completely. You're not going to get Excel out of the finance department. They've written too many macros. You need VBA. There's a whole bunch of other things that are going on. They just know Excel. It's going to stay there. And there's a handful of other areas where they left Office in place. They engaged an outside partner because they did not have the skills internally. And they realized those savings over 3 years. So you're talking about a really small health system saving $1.3 million. That's significant. I share that story just to say it can be done, and the story is recent. It's just picked it up this past week. So it can be done, and it is getting done. Another case where it's getting done, Cloud Summit, GeekWire's Cloud Summit 2019 business sessions. I pulled up a video. BJ Moore talks, and BJ Moore is the CIO that just came from Microsoft to Providence Health and Services, or Providence St. Joseph Health in Washington State, 51 hospitals across the entire West Coast. One of the largest providers, if not the largest provider on the West Coast. And BJ Moore gave about a 30-minute talk, really worth listening to. So GeekWire, search Cloud Summit 2019 business sessions. Great talk from him. He shares a couple of really cool stories around migrating to the cloud. And it just shares how it can be done and why it's not as hard as what your people are telling you. And finally, I have another story. Former Apple CEO John Sculley predicts how technology will change healthcare. This is from the Mack Institute for Innovation Management from Penn University, where he was a couple weeks ago. And I'm just going to share this one quote. So during the decade that I was CEO of Apple, I witnessed the change in the world to how we went from computers being focused on institutions to computers being empowering tools for individuals doing amazing things. And I think this, and he goes on to talk a lot about cloud in this, it's actually a podcast interview. He goes on to talk a lot about cloud in this, and cloud's going to enable a different focus for healthcare. It's not going to be as much focused on business to business and business to doctors and institutions to doctors. We are going to start to figure out how to go directly to the consumer. So much the way that technology changed during Scully's time at Apple, where IBM was focused on selling computers to businesses, and it was going to change the way business was done. And during that time frame, they started selling computers to individuals, and it just changed everything, really. That same thing's happening in healthcare. Cloud is one of the biggest enablers there. Cloud is possible, and it works. We just need to think about it a little differently, and take the steps we need to take to get there. Next story. So telehealth set for a big boost with $100 million in new funding from the FCC. Speaking in rural Laurel Fork, Virginia, Carr announced that the new funding is meant to access. Speaking in rural Laurel Fork, Virginia, Carr, who's over the FCC, announced that the new funding is meant to increase access to care to patients and veterans in remote areas such as Appalachia. With advances in telemedicine, healthcare is no longer limited to the confines of traditional brick-and-mortar healthcare facilities, said Carr in a statement. I think the FCC should support this new trend towards connected care, which is the healthcare equivalent of moving from Blockbuster to Netflix. That's why the FCC will vote to advance my $100 million pilot program at our July 10th meeting. He added that the program will focus on ensuring that low-income Americans and veterans can access this technology, particularly in rural communities such as Laurel Fork, where the nearest hospital is in a different state. Access to telehealth can make life-saving differences. So, telehealth still remains one of the most disruptive forces going on in healthcare. We're going to see more visits, shorter visits, no wait times. We're going to see access to specialists from afar. It just has the opportunity to really transform the landscape, probably the most in the near term. And I don't think it's necessarily a bad thing. I'm going to see my doctor more because I'm not going to have to take off from work. I'm not going to have to sit in a sick room, in a waiting room with a whole bunch of sick people so that I can get sick. And I'm going to be able to do it just like I'm doing it right now on this podcast, but I'm going to be sitting across from my doctor. And quite frankly, as we get better at this as a society, I think the consumer is going to start to demand this from healthcare. So great move from the FCC in creating funding for those areas that, quite frankly, don't have the business models to support taking telehealth out there. That is where the government belongs. That is where they help, taking this to places that are not supported by business models. So, and let's do one more. I want to point out, just every now and then I see a success story, and I think it's worth pointing out. This is how Advocate Aurora Health streamlined prior authorizations. This was in RevCycleintelligence.com. Jacqueline Lapointe. Let me just share a couple things here. So 91% of physicians in the AMA survey reported that care delays associated with prior authorizations an equal amount also said prior authorizations have a significant or somewhat negative impact on clinical outcomes. I've heard the same thing in working with doctors. Prior authorizations are a pain and slow things down. Frustrated with using phones and fax machines to manage the increasing burden of prior authorizations, Hardin turned to Advocate Aurora's EHR system. Makes sense. Hardin is the CFO for Advocate Aurora. I don't have his first name here. About 4 years back, we realized that prior authorizations were a problem, and we wanted to see if we could try to speed up the process and take advantage of the EHR system we had at the time. We thought, what functions are available once our pharmacy does go live on the system, and what do we have available to us? One of the functions we saw was electronic prior authorizations. From there, Hardin assessed the market of technology solutions that could work with the EHR's electronic prior authorization capabilities. After the solutions analysis, the health system decided to implement an automated prior authorization solution from SureScripts. With the solution providers trigger an automated prior authorization workflow by prescribing a medication or service that requires payer approval prior to delivery. The solution has a lot of pharmacy benefits management information already built in. So now the typical prior authorization process happens automatically, Hardin elaborated. The clinic staff never need to touch about 80 to 85% of the authorizations for our patients. So what? I just like ending the show with this. These are the kind of stories that IT organizations need to get out there. Now, I'm sure if I went to Advocate Aurora and talked to a lot of people, we tell the best side of this story. I'm sure there's some challenges and whatnot. But at the end of the day, when you get 80 to 85% of the prior authorizations not requiring the clinical staff to do extra work, giving them the ability to go home, these are the kind of stories we need to be telling and we need to be shouting from the rooftops. So, great work tackling this problem with technology, reducing the burden on clinicians so that they can spend time with their family. That's a big win. So that's all for this week. This Friday, you're going to want to check it out. We had a great time recording an episode in Philadelphia with Dr. Stephen Klasko, CEO for Jefferson Health, as well as Nasser Nizami, the CIO. Great time, great conversation. You're going to want to check that out. Phenomenal episode. So, it's kind of funny. I've been saying we're quickly approaching our 100th episode. We're going to do something special. We are planning something special, but here's a little side note. We already did 100 episodes. Our 100th episode was last Friday. I'm a little behind on getting this scheduled. We're going to do something great. I'll let you know when it's going to be. You're going to want to mark your calendar once I figure out what we're going to do there, but it's going to be fun. And if you want to hear from someone that we haven't talked to on the show, make sure you drop me a line at bill@thisweekinhealthit.com. And that's all. So this show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekinhealthit.com or the YouTube channel at thisweekinhealthit.com/video. Thanks for listening. That's all for now.